Hello, have you heard of sudden infant death syndrome? Okay, sudden infant death syndrome is an unexplained death of a child under the age of 1. It's also called cot or crib death. So now there are certain factors that exposes a child to a sudden infant death syndrome. Most time the death occurs within the age of 1 and when the child is sleeping and mostly at night. And it is called sudden because it happens suddenly, unexplained. The parents cannot say what really happened, and this type of death occur mostly when the child is sleeping. So now I would like to point out some things or some risk factors that can expose a child to sudden infant death syndrome. So if this is what you want to hear, or if this is a topic that interests you, then stick with me to the end of this video. Okay, now talking about some risk factors associated with sudden infant death syndrome. So one is lying the baby face down, lying the baby with his or her stomach. It's not good to lie babies with their stomach, because most time when you lie them with their stomach and they're trying to turn their face, you discover that sometimes most their face gets stuck on the bed, especially babies that are under the age of 6 months, between the age of 1 to 3 months. They get their face stuck on the bed while trying to turn either left or right. So it's always advised that you lie the baby on their back, especially when they are sleeping, to prevent sudden infant death syndrome, because this death is mostly associated with suffocation, where the baby is trying to turn, or the baby is being suffocated with things around the bed, or trying to turn his or her face and the face gets stuck. Another risk factor is allowing so many things inside the baby's cot, maybe blankets, toys, teddy bears, and all that. It should be discouraged. If you have a baby that is less than 6 months, always remove everything inside the baby's cot and let the mattress be firm and okay. So ensure that the cot is does not have anything inside it, because most times so these babies can grab those things and use it to cover their faces when the caregivers are not around. Then another thing is to never allow anybody to smoke around your child. Anybody that smokes, they should not come close to a newborn. If you know that you're the type that smoke, you should stop smoking when you're pregnant, especially when you're pregnant, because smoking during pregnancy increases the risk of sudden infant death syndrome. So another factor is lying on the same bed with your baby. If your bed is spacious enough, that's fine, maybe king size bed. But if your bed is so small that it can barely contain 2 people, then it's not advised to lie on the same bed with your baby. It's always advised that you provide a cot for your baby to lie on, because most times the baby might be at risk of suffocation without even you knowing. You might use your hand to place on top of the baby or on the baby's nose without knowing, or even the beddings can suffocate the baby. Then another thing is breastfeeding. It's good that you exclusively breastfeed your baby, or ensure that you breastfeed your baby, because research suggests that well breastfed baby have a reduced chance of having sudden infant death syndrome. Then another thing is that even though it is good that you lie your baby always on the back when the baby is sleeping, but when the baby is awake, you can as well lie your baby as in on the stomach, to prevent flat head, flat back head, so that the baby's head will not be flat due to excessive lying on the back. So these are some factors that most parents don't even put into consideration while taking care of their newborn. So always lie the baby on their back when they are asleep, and always watch over your baby. Remove excessive beddings, remove pillows, anything that you know that can pose a danger for the baby, or that can risk the baby put the baby at risk of suffocation. Please ensure that you remove it, and also ensure that nobody is smoking around your baby and there is no smoke close to where you are lying your baby. Most people, they can be cooking outside open their window while their baby is inside. Most time these are some of the risk factors that can expose the baby to suffocation. You may not know. You may be cooking outside, maybe using firewood or all those things, especially in rural areas. Most times it's not good. And another factor is that reduce the amounts of clothing. Check the weather. It is you know the weather, you know when there is cold, you know when the weather is hot, when the weather is cold. Don't overheat the baby with excessive clothing. You ensure that you cover the baby properly, but don't overcover or don't overheat the baby. You as a person, you know when you're feeling cold. You also know when the baby is feeling cold. You know the weather. Dress the baby according to the weather. Because you yourself, you can feel the weather. Same with the baby. Most people, they say, yeah, it's because it's a baby, the baby is always cold. No, the baby is not always cold. Dress the baby according to the weather. If the weather is hot, reduce the amount of clothing. Then if the weather is cold, then you dress the baby according to the weather. Don't overheat the baby trying to protect the baby from cold or something like that. So these are the things are what most parents don't know, that can increase the risk of a baby being suffocated or falling, having that sudden infant death syndrome. Apart from that, most infant death syndrome are unexplained. You can't even explain it. You don't know the reason. Some of them are genetics. Some of them are due to congenital heart diseases. Some of them are unexplainable. But some of the things that I've listed are some of the risk factor. Maybe, I don't know, maybe 20-30% of the risk factor that can expose the child to suffocation, and which can lead to sudden infant death syndrome. I hope this video helps a parent out there. Please don't forget to like, share this video, subscribe to my YouTube channel. My name is Nurse Valerie. I talk about pregnancy, labor and delivery. I'm a certified family planning care provider. Thank you for watching. Thank you for listening. Bye. See you next time. Another tip, rate my AI makeup. Yes, this makeup is AI. Yes. Thank you.